Good morning, everybody. We've got an interesting case for you this morning. This is a quick overview of one particular snap and smile case that I did with smile transitions through Glidewell. Hopefully you'll enjoy the video. Thanks for watching. This is a gentleman who has some obvious issues with his smile. He's got kind of a unique situation. He is undergoing terminal cancer treatment, basically palliative care. So his birthday's coming up, and what we wanted to do is try to create a smile for him. We are hopeful that what we provide for him will provide him some peace of mind and some reassurance, knowing that he can smile without being too concerned about the way he looks. Anyway, very nice gentleman. Again, he's got some significant issues. Looking at his teeth, they're all carious. Every single one of his teeth. We had talked several months ago, maybe more than a year, that if we wanted to try to save many of the teeth, those teeth that were savable, I should say, that we'd have to consider, lots of root canals and crowns. But there were some teeth, of course, the root tips that you can see in certain areas that may not be fixable. So the idea was we were going to recommend doing more or less a makeover for him, either with fixed prosthetics, crowns and root canals, and maybe a bridge here, potentially a bridge there, depending on the situation back here. This guy I'm not sure was fixable, so potentially a bridge there. Anyway, fixed prosthetic-wise, we could certainly get him something that would improve his smile and create a better aesthetic outcome for him. On the lower, essentially it's the same issue. We've got significant fracturing and carious lesions in multiple teeth. With his current financial situation and how difficult the challenges with his cancer and chemo and radiation treatment that he's going through, we opted for a less expensive approach. So I had a conversation with him along the lines of, we could certainly ask you to invest thousands of dollars in your teeth, although in the long run it may not necessarily be a good investment. So one alternative might be to consider removable prosthetics. So we talked through taking all the teeth out and going to a full denture, upper and or lower, or potentially saving some, cornerstone teeth that would yield or give us an opportunity to fabricate a removable prosthetic that was a partial denture. Financially, that was also out of his reach. So we decided to do take a different approach and create something for him that was going to be a short-term solution, but provide a dramatic improvement, even despite the issues that he had. Now, let me preface this by saying that I was very upfront with him about, long-term outcomes, and how even though we're creating a smile and improving his smile, we still needed him to move forward with treatment as quick as we can. Ultimately, I always leave it in my patient's hands. I'm not going to twist their arm to do anything that they don't want to do. My job is to educate them and try to explain to them what's going on, what the consequences of an action are, but ultimately empower them to make a choice that works best for them and their wallet, of course. So although the treatment that I'm going to talk about, which is a smile transition, which is what you may have heard of as a snap and smile, although this is a great cosmetic outcome, it doesn't address any of the decay in his mouth. And so we're essentially leaving his decay untreated at his request. So it's important that this is documented appropriately in the chart, and that the patient is told very clearly up front, yes, we're going to improve your smile. Yes, we're going to create a nice cosmetic outcome for you. However, this is not going to end up treating any of the decay that's in your mouth. So, smile transitions, this is a Glidewell product. Price-wise, they're actually very reasonable compared to some other snap and smile style restorations that I've worked with in the past. They just require high-quality impressions. And once the high-quality impressions are sent to the lab will fabricate these acrylic snap-ons. So let's take a look at these. This is the upper, and you can see it looks really nice. cosmetically. I'll put it on the model here in just a moment and show you. Basically, it's just going to have little cutouts for where the teeth are. So it'll snap on right over the top of the teeth. Same thing here on the lower, cosmetically looks great. Very nice. So let's take a look at what the lower looks like in place. So you can see that it's designed just to slide over with a little bit of retention his lower teeth. Let's try it on the other model. This one's real tight. I may have to do some adjusting in the mouth. This might be a more accurate model though, assuming it's not chipped or broken. So there we go. That seems to go down a little bit further, a little easier. So you can see cosmetically that's an amazing transformation. I mean, really phenomenal with how this works. And yes, they're pretty retentive. Hopefully that retentiveness is the same in the patient's mouth. Let's see if I can get that to come off there without too much force. There we go. Looks like we pulled out a little piece of the stone there. So this should be really retentive, but yeah, that engages really, really tightly, very snugly, and it seems to approximate the gingiva pretty well. Now, I would imagine when he comes in for delivery, I'm going to have to do some internal adjusting on the prosthetic with an acrylic burr, just to make sure things mesh. Okay, so that's the lower. Let's take a look at the upper. This one is really dramatic as well. So here's the before, take a look at how he looks, and then sliding this in place. You can see that's just a night and day transformation as well. So this is a great choice. Again, the big drawback about something like this in this situation is that there is still active decay underneath this prosthetic. So patient is aware of it. He's aware we're not treating it. He opted to do that, and he's well aware of the consequences. He requires further follow-up care. We've talked to him about ultimately needing to take these teeth out or fix them as quick as we can. But one of the benefits, I guess I should say, about something like this is we can also use it as a delivery vehicle in a limited way for some fluoride or calcium phosphate. So let's put these two together, and you can see, yeah, night and day. The occlusion, we'll see how that works. This is a mounted model. We did send them an upper impression, lower impression, and a bite impression so they could see how the teeth came together. So we'll see how that works for him. Let me just compare this. I'm not sure that's going to stay together very well with where he's at now. So yeah, pretty big transformation there, wouldn't you say? I think he's going to be very happy with the outcome. I hope that that he enjoys wearing these, and I hope also that we can move forward with treatment to try to get these teeth treated as quickly as we can. But this was a great opportunity to serve this patient. Again, smile transition. This is a Glidewell product. I've had a good success with the Glidewell Lab. I'm certainly not sponsored or paid in any way, shape, or form by Glidewell, but I have had a good positive experiences with them and their productivity. If there's ever an issue, they always take care of it. They're very willing to have open discussions and take feedback. So it seems like a good product. Anyway, we'll see how this works. I wanted to give you a report on this. I should be able to give some follow-up video if I can convince him to let me take some photos of him. Anyway, great case. Smile transitions. Again, this is a snap-in smile removable prosthetic designed really just to do some temporary cosmetic improvement in the absence of either financial means to restore everything or on a short-term basis. So thank you again for watching.